I will be speaking in English, if you don't mind.
Okay.
Merci beaucoup pour la présentation. Merci, professeur Belkadir, pour cette organisation superbe. Okay. So we will be talking today about improving the quality of life of those affected by diabetes. But for that, we need to mention some of the facts and some of the challenges faced in order to do that. Let's start with the facts that you all know, I'm sure, but I have to point them out really quickly, that the prevalence of diabetes is increasing a lot, especially type 2, and it accounts for 90 to 95% of cases. It affects 425, but actually around 5 million people around the world, excluding those undiagnosed. And we all know that there are many undiagnosed cases. Around 40 million people are living with diabetes in the MENA region, in Middle East and MENA region. Some more discouraging facts, in fact, but we will talk about the bright side later on, that the MENA region has the second highest rate of increase, and it is projected to increase by 96.2%. It's almost double, a little short of double, which is not very encouraging, but we do have the bright side of trying to control it through lifestyle changes, of course. Diabetes is the 7th cause of death worldwide, but personally, when I'm doing my awareness presentations, I always say diabetes is not the killer. The complications of diabetes are. So diabetes does not kill you, does not lead you to have amputation. Your neglect, your failure to control diabetes will get you there. So you have a key, you have a weapon, which is awareness, education, knowledge about diabetes. Let's use it. And the final one, which is the highlight of everything, is that we all know that it is highly preventable. Type 2 diabetes is highly preventable, and the complications of it are highly preventable. So let's work on that side. Risk factors, I'm not going to go through them. We all know them. I will only point out the modifiable risk factors, and those are the main one. The star is lifestyle change, and it is about regular physical activity. If you think about it, it's so simple. We all need that, not only people with diabetes, not only people at risk of diabetes. We all need to do those little steps regarding lifestyle changes, physical activity, healthy and balanced diet. Again, we all need to eat healthy to prevent diabetes and other diseases. And regular self-monitoring for those who know that they are at risk, that they have a family history or other symptoms. I know most of you have seen a lot of these. I'm only trying to show it here to see the implication, to show you the implication of lifestyle changes, along with medication in some cases. But the important fact is many people with type 2 diabetes, if they are serious enough about drastic changes in their lifestyle, they can even pass on the medication and only work on their lifestyle, of course, following the instructions of their endocrinologists. The challenges, the main challenges, as you can see, are the awareness and the knowledge. We talk a lot about that, but we are going to see some of the steps on how to raise the levels of awareness and how to give the proper piece of information, because there is a lot of information out there, and there were talks yesterday about the misconceptions and the charlatanism and all that, and people hear a lot of things. If you click on Google, on the research, and you put diabetes, you'll come up with hundreds of thousands of informations. Our role as NGOs, I believe, is to disseminate the proper information, the adequate information, of course, through professionals, whether we are talking sports, through professional in sports, nutrition, through respective professionals, or doctors, endocrinologists, or family doctors. Now, those challenges, I would like to point out some of the solutions we can work on to face those challenges. First, I would suggest that governments should have direct support in promoting awareness in communities. And how? By facilitating and supporting the work of NGOs. Of course, my main idea when I say that is Lebanon, but I know for a fact that we all face the same when it comes to NGOs. We need more support from our governments. We need more support from the respective ministries. We are doing our job, our mission, but we do need more support. Education sector, they have to add or increase, if they have them, the policies to facilitate in-class and on-campus activities. For that, we need the Ministry of Education to open the doors for us. Again, we have faced some of those issues. That's why I'm trying to point them out, since I prepared, based on my 10 years experience in diabetes awareness, this presentation. So we do need support in order to have more in-class activities and on-campus activities, and why not make them a part of the curriculum? We don't need only professionals, people holding degrees. We need healthy generation. We need people less at risk of diabetes or other diseases. The private sector, direct or indirect support to the NCDs working organizations to make it more global, because we do know diabetes is related to many other NCDs diseases. Now, how to improve the quality of life of people with diabetes? I will speak about 3 points. I will detail them afterwards. First, to collaborate and partner with the health, education, and sports sectors, because I believe those public ministries are directly related to the diabetes issue. Secondly, is to raise diabetes the awareness levels in institutions. And this is very important. And train the HR people, the human resource people, personnel. We need to train them. I've been working on corporate programs, and we've been to big organizations. They don't even have a nurse. So if any emergency happens, they need to have someone trained to know, especially that many cases of type 2 diabetes are amongst this population of associates or employees at big corporations. And most importantly, number 3, we have the link between private and public sector, the famous PPP, public-private partnership. And we supposedly are starting something like this in Lebanon. Wish us good luck. We do need it. So in the first point, I would like to talk regarding the collaboration and the partnership with ministries. First, we need to increase the collaborations with the public sector to implement healthy habits and behavioral changes. I'll give a few examples. The cafeteria at a school. We need to do a model cafeteria, and we need the ministries to reinforce that by law, to force all schools to follow that model. What do you find at a school cafeteria? Everything we do not want our children to have at school. So we need to start at that early age. This is one example, but there are many other examples that we could be working on. But for time restraints, I will not give more examples. Long-term investments and grants to reduce the number of increasing diabetes cases, the burden of the diabetes, and the health care costs and mortality. We all know that by preventing diabetes and by controlling and preventing the complications, we are doing a favor to the Ministry of Health and making less the burden and the costs of diabetes in each country, regardless whether in the MENA, in Africa, or wherever it is. Then we have the interventional approaches to be integrated into prenatal and postnatal education care. I've seen a lot of that happening. We tend, again, following the misconceptions, to think a big baby is very healthy. But nowadays, we do know that a big baby is more prone to getting diabetes with the time. And many people neglect to do the proper tests for a pregnant lady. It is getting better and better, but we need to be very strict with that, as that is the base for the health of this future baby. Nutrition education and exercise promotion at schools to prevent and reduce obesity. This is a key word when we talk diabetes, and we all know that it is increasing big time. So we need to work on that to prevent those youngsters from getting diabetes and other diseases in the future. The second part of how to improve the lives of people with diabetes is to work with the human resource personnel, identifying high-risk subjects, and to raise education levels to decrease diabetes cases on the long term. It's not only to decrease, it's again to prevent. And in those big organizations, there should be ongoing educational sessions, inviting NGOs, inviting professionals to give the proper information through educational material to those associates. Empower health experts through continuous education to decrease diabetes prevalence. One point I would like to mention here, many times the dietitians or nutrition professionals, they are focused and oriented to work on weight loss. That is great, but that is not the main purpose. The goal and the main purpose is health. It's not the weight loss. Weight loss would be a consequence of a proper nutrition, and those nutritionists amongst us will know that this is how it works. So we want to educate our professionals to orient them to not only focus on weight loss, but on health in general. Deliver services targeting geographic regions with severe human resource constraints and to population with special needs and, of course, rural areas. We've heard again in some of the presentations, and Professor Morsi mentioned it to me when we were having a conversation, that the members association should not focus their work in the capital or in the big cities. They need to work all over the country, depending on their capacity, of course, but they should work toward that. I have a surprise for you, Professor Morsi, at the end of my presentation, but this is definitely a must, and all members association, we should work on expanding our work. To leverage the technical resources through creative partnerships with universities, medical center, and individual, and it is obvious, anytime we put hand in hand with any other institution, our efforts would be greater and the impact would be even greater. Recruit volunteers advocates through educational programs in schools and universities. We need to educate our young generation, not only to focus on their degree. We need to work on their volunteering spirit. We need to plant in them since early age this need to give something back to your society. Even though if you think society is not giving you much, you need to give something back for self-satisfaction and fulfillment. The third point, which I spoke about earlier, the PPP, private-public partnership. First, I'll say to increase the capability and raise resources to defeat diabetes. We can think of lots of projects, but if we do not have the means, they will remain projects. We want to put those projects in practice, so we need to have resources, we need to work to obtain the resources in order to put those projects in practice. Increase innovative approach. To get to a broader population, sometimes we need to work with an artist, with a singer, with a biking champion, with a hiking champion. Why? Because we want to create an impact. We want to shake people, to tell them, you are a fan of this person? Well, this person is working hand in hand with the Diabetes Association, so it calls their attention and we get to broader sector of the society. Build and update reliable data sources. I don't know of other countries. Some I've heard they have our same problem. We do not have in Lebanon an updated database. So for me, this is a must. What is problem is that if we as NGOs do the study or we do the screening, we create a database, it is not recognized unless it is endorsed by the Ministry of Public Health. So we are working again on that, toward that partnership in order to have a reliable and updated database because it is a great help. To disseminate awareness and prevention methods effectively in the community. When we speak disseminate awareness, we need to give them something in hand. For that, I'll give you the example. We have a yearly magazine called Dialab Review. I'm using our case, of course, but because I know what we are doing. And it is downloadable on the internet, on our website. So why do we do that? we know that internet exists and we have it as a downloadable version. But sometimes when people have, especially in rural areas, and it is Arabic and English, when they have in their hands something colorful with pictures, with known personalities, we have an actress on the cover amongst the other ladies. So it invites them, it's appealing to them, and we want them to read. We want them to see how, through information and proper knowledge, they can prevent or control diabetes. Increase access to healthcare, advocate for changes in laws, definitely, if we want to make the situation of diabetes better in our countries, we need to reinforce that through laws in order to make it happen. Now, the action plan for the famous PPP, public-private partnership, again, for that, I will use the model of our programs that we are already implementing. We've started implementing them 8 years ago, and I can see already the impact that it is creating. Diabetes in the classroom, definitely. We're talking schools and universities. Community awareness programs, we are talking a different age range. For that, we partner with municipalities and other NGOs in order to address the community and to spread awareness and raise the levels of awareness. The corporate awareness programs, that's why I mentioned how important it is to empower the HR department in each enterprise or company. Community internship programs. We have a program, we receive professionals, young graduates, and we have them have a feel, first-hand feel on how you work in the community.
Could you shorten, please? Just.
Okay, so I'll hurry up for that. Distribution of educational materials, screening campaign, patient support groups, and although we are talking mostly type 2, type 1 group is very dear to my heart since I have a daughter who has type 1 diabetes, and this is why I have a mission and a passion for my mission and for the diabetes cause. Professor Mursi, this is where you see the red dots, and for all of you, of course, the red dots represent the areas in Lebanon where we have been conducting awareness campaigns, whether through schools, universities, community, municipalities, sometimes open air, no roof on top of us, and doing screening campaigns and all that. I had in mind to let you know how much we've been doing as Dialab, but that's okay. And just to mention, probably you're all familiar with the SDGs, Sustainable Development Goals of the UN, and number 3 is about health. We've been working on that. And the final notes would be that we must become more involved and perform our essential role to save lives and to reduce healthcare costs. And Dialab has made it a priority to inform, educate, and assist communities through our multi-channel awareness and prevention programs. I will skip that. Those are my references. Of course, the IDF website, the Ministry of Public Health website, Dialab's website, and Diabetes Atlas. And I will finalize by saying that together, yes, we can control diabetes. Thank you very much.
Thank you.